Hi guys, thanks for tuning into my video. My name is Caitlin Stratemeyer and I'm an OT student at the University of Tennessee Health Science Center. So the topic that I will be discussing for my in-service presentation is the insider scoop to OT in acute care. So there are 3 learning objectives that I plan to address during the presentation, which are identifying the role of OT in acute care, identifying OT intervention strategies in acute care, and identifying discharge settings and qualifications for each. So before I even begin, I do want to state that I gathered my information from multiple sources, which include otmary.com, Shannon Marie OT blog, and the OT Potential blog. And so I chose to gather most of my information through blog sources because I just wanted to get a firsthand experience from OTs that have been working in acute care for quite some time, just to see what their day-to-day schedule is like and just to get that firsthand feel. And then I also did gather information from textbook resources as well. So before we even begin, I do want to encourage everyone listening to either take out a piece of paper or you can formulate a list in your head of all of the roles and the responsibilities that you think that OTs in acute care deal with on a daily basis. And following that list that you've formulated, I also want you to click on the link that I provided for otmary.com and kind of peruse her website so that you can add to your list. And I just really like her website because it gives you like a rundown of the day-to-day activities in acute care. So you can go ahead and either pause this video so you can formulate your list, or you can keep listening. So moving along, AOTA defines acute care as an inpatient hospital setting for individuals with a critical medical condition. So the types of patients that you're normally going to be seeing are still in need of 24-hour nursing care because they're coming in with conditions that are normally not stable and oftentimes they're life-threatening. So often patients have experienced either a traumatic event or their progressive disease has significantly worsened, or they're coming in because of a new onset disease or condition. So the types of patients that will often be referred for OT in acute care are your spinal cord injuries, strokes, sepsis, congenital heart failure, and other types of pulmonary issues as well. And also you will be seeing a lot of comorbidities that are going along with this condition, which makes it that much harder to treat. So a normal stay in acute care is usually about 2 to 3 days up to a couple of weeks. So treatment sessions vary depending on the patient's level of function, but a session is anywhere from 10 to 40 minutes, and that's 5 times a day. So these are very short treatment sessions, and that's why it's very important for OTs to come to the session prepared with multiple interventions in case the first option doesn't work. So something that I found to be interesting is that occupational therapy is actually the only spending category that has been shown to reduce hospital readmissions. And this is due to the goals that OT has decided to focus on in acute care. So those main roles include reducing the risk for further decline, improving function, early mobilization, coordinating care, and assisting with transition and discharge planning, which is a large one in acute care. So basically, we as OTs, we see our patients at their lowest and their most critical state of health. And really, it's our job to bring them back to baseline so that they have just enough function and strength to become stabilized enough so that they can move on to a higher level of rehab. So with that being said, let's discuss types of interventions that are most commonly seen in this area. So when thinking of functional interventions for these types of clients, we do need to bring it back to the basics. So oftentimes that will include ADL retraining, which will be necessary for most clients that come into acute care because they have experienced muscle weakness and loss of range of motion. And then bed mobility will be occurring quite a bit as well. And this is an important intervention for our clients since they will most likely be on bed rest for quite some time to recover from their condition. And it's important that we're making sure that they are moving around safely and efficiently while they're in bed to reduce the risk of skin breakdown and also just to increase their comfort. Another big one is education for caregivers. Often this occurs when a patient is ready to be discharged, especially if they're going home. And it's important to teach our family members and caregivers to assist with transfers, mobility, skin inspection, and range of motion exercises, especially if they're headed home and they need extra help. So depending on the condition, splinting may also occur along with adaptive equipment training, managing edema, especially for those who have undergone breast cancer and things like that. Energy conservation strategies are also very important. And due to the limited time with our patients, we do want to address early mobilization and restoring function as soon as possible, which can be addressed by all of these interventions that were mentioned. So something that I found that was convenient was the use of an occupational therapy toolkit. So since all or at least most of acute care treatment will occur within the hospital room, OTs are often limited in the equipment since we don't have access to a therapy gym. So some of the must-haves that I included in the therapy toolkit is the big one for me is a pulse oximeter. So I know firsthand from working in a hospital how hard it is to track down a pulse ox. And I think it's a good idea for all OTs to really just own your own pulse ox because you will be using it almost likely every single patient in acute care so that you're able to track their heart rate and their oxygen levels while they're performing their daily activities. Another item that's recommended is a gait belt for safe transfers and a stopwatch that you're able to record their times while they're doing activities. And then another big one is bringing around with you your basic ADL supplies, such as extra socks, extra toothbrushes, extra washcloths, just because these items will be used a lot in almost every treatment session in acute care. And it's a good idea just to have them with you before you even enter the room so that you're not having to run around the hospital tracking these items down. So because patients in acute care, they come in almost as fast as they leave, OTs basically have to begin discharge planning on day one. So OTs play a huge role in helping to decide where a patient should go next to continue with the rehab process. And so that's why I do want to discuss the different settings and what qualifies a patient to go there after acute care. So the main one is going to be inpatient rehab. So for this one, you must qualify under one of the 13 diagnostic categories, and the client must be able to tolerate a total of 3 hours of combined therapy each day. And the next one is long-term acute care. And so these clients require a high degree of care, and a lot of the times they're still receiving services such as wound care and long-term antibiotics. Then we have a skilled nursing facility. So if someone is not able to tolerate the 3 hours of therapy a day, they will go to a skilled nursing facility where they are required to do less therapy and they have more time to rest and they still have 24-hour care with nursing. Then we have home health, which you must have a client who is homebound. And then you have your outpatient occupational therapy for our clients who have recovered, but they just still need that extra push and some more therapy to make a full recovery. And then we have our hospice or palliative care, which is our clients who are terminally ill and have less than 6 months to live. So to end, I just want to give a quick rundown on the essential must-knows of acute care according to OT Miri. So on her website, she lists that one of her major things is knowing your basic medical terminology. So as I've said over and over again, acute care is a very fast-paced environment, And chart review is very important, and you must be able to do it very swiftly and efficiently. And communication in a setting like this is very crucial as well. And it's important to be able to communicate with the whole medical staff. And what I do like about OT Mary's website is she does supply a whole list of a ton of free apps that you can download to practice medical terminology. Another biggie is knowing your critical lab values. So you need to be able to recognize if a lab value is abnormal in case you have a client who is being contraindicated, but yet the medical staff has not yet put a hold on therapy. You also need to be familiar with your ICU equipment. It's critical that you understand what you can detach and what you can't detach during a therapy session. And then safety and infection protocols, which is significantly important right now during COVID-19. And there's also a possibility that you may be doing a treatment session with someone with an infection. So just be sure that you know your facility's protocols and ensure that you're protecting yourself and the patient. And then review contraindications and precautions. So following surgeries, often a doctor has put some sort of specific rules on what they can and can't do in therapy. So we want to make sure that we're following these rules. And common contraindications that you'll see in acute care include sternal and cardiac precautions, hip precautions, spinal precautions, weight bearing, lymphedema, and wound care precautions. So be sure that you brush up on these before you see a patient with these contraindications. So that was a quick rundown on the insider scoop to acute care. If you are someone who enjoys a fast-paced environment, if you enjoy working with a variety of diagnoses and conditions, and if you're interested in being exposed to complex medical conditions, then I suggest that you check out a career in acute care. So that's all I have for you during this presentation. And following, there is a short quiz that I would appreciate if everyone could take. And I hope that I was able to supply you with some useful information on acute care. Thanks for listening.